Hi, my name is Dr. Enrique Saguil. My friends and patients know me as Dr. Rick, and I want to thank you for checking out my site. The way you came to this was either through YouTube or a friend, or you are looking for somebody to help you with your suffering. I'm a family practitioner that's also trained in sports medicine, integrative medicine, and traditional Chinese medicine as far as medical acupuncture. I happen to be a yoga instructor and I love working out, so I also train people in the gym. But my value, I believe, is what I want to explain to you. I practice integrative medicine, and that's what I hold near and dear to my heart. If you look at the root word of integrate, it comes from Latin to make whole. And the idea in old traditional ancient healing systems like Ayurveda out of India, traditional Chinese medicine out of Asia, even Native American healing, it was always considered a whole system approach where you don't just look at the symptoms or the mind or the wound or the extremity. You condition yourself as a healer to take care of the whole person. And that can go not only into the physical, but also the mental, the spiritual, and the family, social-based values. And I think that is great. But Western medicine, which has only been around for 200 plus years, compared to 3,000 years of ancient healing systems, Western medicine has packaged taking care of people in a totally fragmented way, all controlled by insurance. If you're lucky enough to have a doctor that doesn't take insurance, I think that's where we as physicians or integrative medicine specialists can really show our value. I'm assuming that you're coming by to figure out if this is a right fit for you. I do this as my calling. I love working with patients, trying to figure out things. My first approach is to stop suffering. Even with a whole bunch of medicines on board, a lot of people are suffering. I think if you can stop the suffering or control the suffering, you can empower somebody to take hold of their life. You're always in charge of the direction where your life will go. That's why I have that sign about enjoy the journey, is because I only do virtual visits nowadays, but I used to see patients behind that door. Once you enter that door, we're going to work to try to figure out the dynamics of how they got to this point. I think if you can reverse engineer where you came from, it'd be easy. You just kind of get to where that fork in life occurred and you try to reverse all the disease by going back and practicing life the way it was back then. My career is that as a doctor. I work for hospitals or systems. Large systems are necessary to take care of the community, because a lot of people do have the opportunity to get into their doctor's office with some form of insurance. That's at least in the hospital. As far as the specialists and the subspecialists, it depends. The higher you go on a totem pole with the specialties, the less the possibility that that specialist or super specialist will take your insurance. I have to admit, I'm a super specialist as well. Now I'm incorporating everything that I've learned into my own life to hopefully live till 100, but also in the lives of my patients, because everybody is complex. And I think that if you have been given Band-Aids by those specialists that you see, that's okay. I think it's necessary. Now, the idea though, for example, where I work as an immediate care doctor, the system is there for the community, and the community is sick sometimes. But once it gets cold, and COVID comes around, and influenza, I had a couple other kids that were sick, you're going to have a line of families waiting to get in to get care because they can't get into their primary care doctor's office. So there comes the immediate care. All we do is evaluate, test, come up with a diagnosis, treat, next patient. That's the way it is. You have to understand that that's not going away. And it's necessary, but that's not where you're supposed to stop. We put Band-Aids on and either send to the specialist or send to the primary care or send to the ER. And after you get those Band-Aids, it's up to you to learn how to change life around. Thus the journey. But the problem is a lot of people are very confused. I think there's a lot of great information. I mean, the internet back in the 90s, I think it was 1995, I graduated from sports medicine and became an official doctor. I was on cloud 9 because it was fun. You're looking at every disease process like there was a sport or there was a way to fix it or fine-tune it. Blood pressure with cardiovascular fitness, or heart disease with exercise and diet. So mood disease, depression with some form of hiking. There's always going to be a way to take care of things that's not prescription-based or procedure-based or implantation device, but to start reversing the disease so you don't have suffering any further, you're going to have to make an investment. To see an integrative medicine doctor and spend the time that it is necessary to learn who is in the room with the doctor, it takes time. And as I mentioned, if we go strictly on insurance payments, we have to get people out. In my other life, my career, we have to get people in and out in 15 minutes, and that kind of breaks even for the malpractice we have to pay, for the taxes we have to pay, the overhead that we have to pay, the electronic medical record, the staffing, the people who call back, the people who call the insurance, the people who submit to insurance, a person to scan the chart that we just typed up and send it to the insurance and make sure we get paid. There's a whole back room of people that have to get paid. Hospital systems, for profit, know how to do this, and that's why they're there to serve the community, but they also have to make a profit. And I've always considered myself a bad businessman because my heart is in healing. And oftentimes when I hear somebody suffering, I want to give them the extra 5 minutes and say, can I fix this person, or just give them a different perspective? Sometimes I have to hold my tongue because it's going to take too long. But if I see you virtually, I think I can do more for my community and humanity being virtual. And some people would say, well, wait a minute, how do you do a physical exam? No question, for sports medicine, it would be helpful for me to evaluate a shoulder, evaluate an ankle, evaluate a knee in the acute phase, and then see x-rays. But 80% of the diagnosis in any specialty is from the history taking. But that takes time, and we don't have time in traditional medicine. A lot of doctors now are not happy. At least I don't see the excitement, like the excitement I had when I graduated my sports medicine fellowship. I was ready to take on the world. I could come up with a diagnosis and tell you how you should exercise to change the disease process you had. That was exciting, and I loved opening the door and figuring out who's in the room. This is gonna be exciting. Let's just come up with a diagnosis. When I see and spend time, I figure not only am I going to help this person heal and be witness to that healing, reversing disease, but I can also watch or observe, if I can live long enough, the generational change that'll occur with that one meeting. Because if that person changes, they'll change their kids, their grandkids, their nephews, their brothers and sisters, maybe their parents. We don't have time in the immediate care center to do that because, again, to be profitable, I have to get people in and out. If you have a cold or you have a cough or a sprain, you don't want to be there for 3 hours. So I think we have to be efficient for the work that we do, for the hospital systems that we serve. Stop the suffering, but sending off to specialty, primary care, or ER. Those are the 3 options to continue the healing process. That is a journey too, and it can be a useful journey, especially if you're a cancer victim or a major trauma from car or motor vehicle. I don't want to be anywhere else except the United States because I think we have the best medicine for that complex of a disease process. But you have to be linked with several different specialists. The older you are, the more specialists you'll have to see. And last thing I want to do myself is to spend my retirement seeing a new specialist and having a doctor visit every month or every 2 weeks. That's depressing. You can't go anywhere. In fact, if you go somewhere to a foreign country, you have to know what to do in case you get sick in the foreign country or your disease flares up. That doesn't sound exciting to me. What sounds exciting is just enjoying life, enjoying your family, enjoying what nature has, and then using this instrument that we're given, which is miraculous, to give back. Whether you're stuck in Western medicine, you have a lot of specialists, you are still in control of that journey. I think it's fair game for that doc, whatever specialty they're in, even the primary care, to entertain your question, research the answer, and then come up with a personal game plan for you. If they are nice enough, they'll do that. And I've seen some very great specialists, especially where I work, and they will take their time. Then there's the other aspect of healing, which is what I do online. Since 2020, when COVID came on, I decided to split from Western medicine and try to open up my own practice because I was getting good with this video thing. I'm 62. I have to ask my kids about how to film stuff. I'm always asking the younger nurses and doctors at where I work to help me with the computer, but I kind of get it. I just happened to start 2020 when the world was falling apart and everybody was fearing death. But I also found that that was the best way to step off the curb and take a chance. I honor those patients who supported me and trusted me. And a lot of you are still with me, which really makes it so humbling to know that I'm able to make a difference in somebody's life. And that goes back to the value. The value of producing a change is limitless. There's an old saying when I was brought up, beauty is in the eye of the beholder. I mean, that means that everybody puts a different value on what they want. Tickets to a Justin Timberlake concert, and he's a great performer, you've got to pay thousands of bucks if you want to really see, and I can't see because I have to be in the front, but I can't afford that. I'm fine with going to the concerts in St. Charles or in Wisconsin at the Genesee and seeing like Criss Cross for 57 bucks. That's valuable because even if it's not the biggest arena, just listening to the guys that I grew up with reminds me of my youth and happiness. Or courtside. I can see where it's really cool to be right on the court and see the action and give a high five to some of the NBA players. I would never pay that kind of money. Before I probably would have. When I was on fire and I had long hair, I used to have hair down to here for my old patients out of Wheaton, and I had a lot of fire. I think there's value in what I can provide for my patients in this paradigm of medicine where it requires membership. Most of my visits are an hour to an hour and a half, and I don't want anybody to get fatigued, but 60 minutes is the least amount of time. But if I spent 60 minutes and only took insurance, I would really go bankrupt. I'd have to pay you to see you, and that doesn't make sense. It's a bad business model. That's why I have to charge, and many of my colleagues in integrative medicine that spend the time and have the knowledge base, they do charge money. Truth be told, I've seen some integrative medicine doctors, no offense to the functional medicine practitioners out there, but there are some of them that are really charging like $600 a visit. And I look at their training, I'm trying to think, how did they come up with the knowledge base? Okay, I'm not criticizing them. I'm sure they're very good healers. If I was gonna pay for something like that, I want that person to produce something for me. I don't charge that kind of price. I just charge an annual fee, and then I try to bill insurance as best as possible. Again, the calling I have, it's kind of cool to fix lives and send somebody else off on the trajectory of healing that just looks great. I love stopping suffering, but it takes a lot of investment, and if you're willing to learn and put the due diligence in as far as exercise, nutrition, it usually means less nutrition, sleep optimization, love and calming practice. When you take care of those pillars, you should be bulletproof. Depending on how deep you are into suffering, we might have to devise a very intensive plan, short and sweet, and a whole bunch of them to daisy chain your way to a great summit. That's what I call it, a summit of change. But people are different. I have some guys who just need to be guided one time. They see me once a year. I have other guys that come and see me every month on the button. Regardless, I still want to see change. If you're going to come to me and pay the membership and not see me, forget it. Along those lines, I will tell you that if you don't participate, even if you pay the membership, I'm going to have to boot you from the practice because my time is valuable. I can only have so much time in my calling. If I just did 15-minute visits forever and had no way to really enjoy medicine, I'd be sad and I'd want to retire and I'd want to just take a lot of paycheck and bonuses, build up and then retire and get out of medicine. And that's what I'm seeing with my colleagues. I don't see the, this is awesome kind of reaction. That in a nutshell is me. I'm pretty confident I can guide you and come up with ideas that no one else has come up with. Even your specialist, if this is all you have, this being the traditional medicine, insurance-based medicine, and this being more of an integrative practice. If this is what you're used to, I'm sure I can guide you and give you a lot of suggestions. Whether we stay with medicines or whether we start to invest in changes, slowly or more aggressive, like all in, whatever makes the most sense. And I'm gonna have to be a coach, so if you wanna do all in, but I don't think you're ready for it, you're gonna have to listen to me too. The true meaning of doctor is teacher. And I honestly believe whether I'm in one place or another, I have to teach whoever walks in the door to see me. Teach them how to stop suffering, teach them how to reverse the suffering, teach them how to grow from there. And we can all get hopefully old without that much as far as medicines, procedures, implantable devices. And I've seen a couple of my other functional medicine docs just get people off of their prescriptions, but then they have a whole shitload of vitamins. I don't want that. I take a handful in the morning and I take less at night, and I have to kind of pick and choose my months or my seasons because it's expensive and I can't tolerate all that stuff anyway. I can guarantee you I can probably beat a disease and get you off medicine knowing what to do temporarily with supplements or nutritional changes or mindful practice. And then the next step would be to get you off the supplements and just go easy, totally natural, or commando as I call it. Not commando naked, but commando no medicines. That is the ultimate expression. I have one or two people like that. They're called my boring patients. But listen, even boring patients get sick. eventually. So it's always exciting. So hopefully this gives you a little bit of an idea about what I do with my practice in integrative medicine. It is virtual, and again, 80% of the time I can come up with a diagnosis just as well as your specialist. If you're a little apprehensive about investing, I have a plan that everybody has to pay a subscription or membership fee. It's a once-a-year payment. If you're a little apprehensive, then I offer a test drive. That's a one-time fee. That's going to be an investment too. And if you're comfortable and you're satisfied with what I can give you as far as advice and the time we spent and the ideas we come up with and the planning, then I'm sure you'll want to prorate that to the entire membership for the year, which is what I honor. Since 2020, I'm blessed to be in this predicament of mine, which is one foot in intermediate care / Western medicine, insurance-based medicine, and one foot deeply entrenched in a whole system approach, integrative medicine. So I will always be with one foot in both worlds, and I can flex, not physically flex, but I can flex between what's more important. I plan to be with you and exist without disease for the longest time possible. And if I can get you to do the same, that would be great, because you can translate that to happier and healthier life, in addition to passing that on to your kids, your parents, your family, your tribe. So if we can just see this nuclear explosion of health, that would be awesome. That would be a dream of mine. I'm not sure if it'll come true, but I'm still going to work for it. So ultimately, thank you for checking me out. Hopefully this wasn't too long of a rant. Anybody that's just passing by is probably going to click off in 2 minutes, or is it 3 minutes that YouTube algorithm says, but you've watched up until the end. And if you have any questions, I'll put my email, my personal email down below, and you can send them to me. Otherwise, hopefully I will see you online. Some of the patients that I see, I really have to see them in person. Whether I see them in my Hoffman Estates office, or I see you wherever I see you, especially if I go to another state and I'm participating in a hike. Don't be taken back by the fact that my practice is only virtual. Get ready for healing and an intensity that you've never experienced before. Thank you for watching up to this point in time. If you're checking me out for a relative, then you can send those questions you have to the email I put down. Otherwise, hopefully you'll find your way, whether you join up with my practice or you choose another integrative medicine doctor to help you with your coaching and your direction. Always know that you're in charge of this healing process. You might be a little old or deep into a lot of disease and suffering, but you're still in charge of that. You can take those medicines that we give you and those procedures that we're suggesting, get them, make sure you're happy with the decision. And don't just stop there. Know what to do after that medicine is deployed or that procedure is done. Know what the next step is to get yourself back to healing. This is Dr. Saguil. Thank you for stopping by. If you have any questions, leave them down below. Stay healthy. Try to strive, take care of your family and yourself. And I'll see you at the next video.